Thanks for joining us for another fun vision therapy exercise. This exercise is called Ring the Cones. So this exercise is working on several visual skills, one of them being peripheral awareness. So peripheral awareness is the ability to be aware of your peripheral vision. So let's go over that term because it's really important. Central vision is what you see in the very middle. Like when you're looking at something, it's right in the middle. But peripheral vision is what you see on the sides, also known as our side vision. That's really important because peripheral vision helps us not to bump into things. It helps us to be able to drive better because you can see cars coming up the corners of your vision and so you don't crash. Peripheral vision is very useful in everyday life. It's also very helpful when we're treating things like eye turns because having better peripheral vision helps our eyes to be more aligned. All right, so are you ready to get started for this exercise?
Yep.
Awesome. So go ahead and jump onto the balance beam. Well, step nicely. There you go. And for this activity also, it's also a great exercise to work on balance and coordination. So because the purpose of this exercise is to practice our peripheral vision, let's get a central target. So you're going to look straight ahead.
Okay.
And for this activity, you can put things like a sticker on the wall. Sometimes we put a magnet on the whiteboard. Right now, you're going to look straight ahead at you at the target there. Okay, so now before you start the exercise, can you see the ground with your peripheral vision?
Yeah, I see the ground.
Awesome. What do you see on the ground?
I see cones.
Awesome. So you see the cones. Can you see the balance beam?
Yes, I can see the balance beam.
Can you see me over here?
Yep.
Good. And you see how when I'm talking to him, he's not even moving his eyes? That's perfect. Now, if he was peeking and he was like, what? I want to look at the cones. I want to look at me. That's technically not peripheral vision anymore because then he's looking at me with his central vision. So he's doing a really good job at not peeking. Okay, so now with your peripheral vision, can you tell what color cone is next to your right hand?
Like here?
Right down there. Yep.
Yellow?
Oh, that's a good guess. It is yellow. Can you reach your hand out and try to put the ring on top of that yellow cone?
Can I like squat down?
So if you need to. So if you can do it without squatting, then great, because that means it's further away in your peripheral vision. But if it's a little hard to tell, you can squat down so it comes a little closer.
Okay.
Go ahead and drop it. Good. And then if you want to try again, go ahead and get another ring. See if you can catch it again. Oh, you're getting really close. You can take a step forward if you'd like to. All right, pretty close. Try again. Great. Okay, so let's say that it's a little bit tough to see. Okay, so now you can crouch down just a little bit on the balance beam. Maybe take one step back. It's a little bit out of your peripheral vision now. There you go. And then now can you see it a little better out of the corner of your eye?
Yep.
Good. Keep looking your eye straight ahead at the target. Now see if you can catch that yellow cone. You're really close. Keep going. Yep. So it's a tricky exercise, huh? Okay, go ahead and I'm gonna let you look so you see where you were. So you were close, right? But the yellow cone was maybe a little bit there. So now that you get a sense of it where you are, look straight ahead at your target again. Use your peripheral vision now, see if you can get it. One more. Oh, you touched it. That was really great. Okay, so now we're reset. Keep going. This is a really great way to work on the accuracy of your peripheral vision.
Right.
Let's go for this green cone right over here.
Okay.
Let's go on that side. Okay, now can you see it out of your side vision?
No.
No? Okay, so go to a position where you can. It might be because it's kind of tight. Do you want to try for this blue cone?
Sure.
To get more space?
Yeah.
Okay, so try for the blue cone.
Oh,
that's
let
okay.
me get that.
No worries.
Okay. All right.
Yep. And then just keep trying to say, okay, I see it over there. It's down in my corner. Yes.
Did I get it?
Yeah, you got it.
Oh, nice.
Okay, so see if you can go for the blue cone that's on your right hand now. Okay, and you can go forward or you can go back so that you can get a good sense of where it is. And you're gonna say, okay, I know it's over there somewhere, but see if you can really, judge how close or far away it is from you. That's okay.
I haven't looked at that.
That's okay, no worries. You're doing great. Yes, got it. Okay, see if you can get the red cone that's now near me. Okay, keeping your eyes on the target. So remember you're looking forward. Go again. You can bend down if you need to, if you feel like you can't quite see it very well. Oh, he's got some more. Yeah, you touched it. You're really close. Okay, and keeping your eyes straight ahead at the target. Okay, let's do the last cone. Let's do one cone on your right side. Yeah, go for that one. Got it. Okay, now you've got the hang of it. Let's do again. So start over. Let's pick up our rings.
All right.
Okay, there you go. Okay, so we'll start from the beginning. Okay, do you feel like it was easier to stand tall or to bend down?
Kind of bend down.
Okay, sure. So go ahead. You can bend down. It's no problem.
All right. So
Yeah, like that. Yep. That's fine. Yeah, you can even crouch down like how I am. If you feel like you want to start at that level, you can just kind of go on your knees like this, because that way you're much closer to the cone. Yeah, there you go. Keeping your eyes straight ahead. Remember, because you're using peripheral vision. All right, I think you got the hang of it there. Go ahead and go from the beginning. Get the cones on this left side here. Okay, eyes straight ahead. So where's your target? Yes, like that. Go again. Keep going. Keep going. Try again. Go for this red cone right here.
Okay.
All right, that was a good effort. Okay, so now if we want to level this activity up, it's tough, huh? Yeah, it seems like, oh, that's easy. I just put the ring on it. But when you can't look at it, it's definitely very challenging. So now what we're going to do is we're going to spread the cones a little further out, because when the cones are close to the balance beam, it's closer in your periphery. Now we want to push it further out in your periphery. So we're going to space it out a little bit more like that. Great. Okay, awesome. And then let's reset. Let's have you go onto the balance beam again. Let me give you a whole bunch of rings. Okay, you got enough in your hand there? Here, I got a few more for you. Okay.
Nice.
All right. And then tell me, can you tell color? So again, looking straight ahead at your target. Can you tell what color it is, or is it too hard?
That's a yellow over there.
That's a yellow over there. What about the one next to you here, this side?
A blue?
A blue? Sometimes it's kind of hard to tell color. And you know what? That actually makes sense, because the receptors in our eyes that see color are more towards the center of our vision. And the ones that are more towards the periphery can't see color as well. So that's okay. But go ahead and see if you can try to get this green cone right here. Yes. And then see if you can try to get the yellow cone by your right hand. Keeping your eyes straight ahead. Good job. Take a step forward. Eyes straight ahead on the target, using your side vision. See if you can get this blue cone right over here.
Was that the blue cone I was looking at, maybe?
I don't know. You can step forward or back if you need to. You can bend down if you need to. There you go. Okay, see if you can get the blue cone that's on your right side. Good. Okay, that was a great demonstration. If we want to level up this activity, so to make it harder, again, the further we stand up, the further away we are from the cones, the more in the periphery the cones are, which makes it more challenging. Another way we can level up the activity is we can use smaller rings. So he had the big size rings, then we can make the rings smaller. Let's talk about ways to level down the exercise. Maybe we need to make it a little easier. It looks easy, but it's actually a really challenging exercise. We could raise the cones up. So like you could put it maybe on a stool, so that the cones are now waist level instead of on the ground. That's a way we can make the exercise easier. We could take away the balance beam and just put a masking tape on the ground, and that could make the exercise a little easier for some of our younger patients. All right, but the biggest key for this exercise, again, is peripheral vision. And that means that when we're trying to put the ring on the cone, we're not peeking or moving our eyes. We're gonna keep our eyes straight ahead and using our peripheral vision to put the ring on the cone. So hope that helps. If you get really great at this exercise, it will help you for sports, it will help you for driving, it will help you for navigating your environment so you don't bump into things as much. So have a lot of fun with it, and hope you enjoy this vision therapy exercise. See you next time.